Welcome to CareTalk, your happy home for incisive debate about healthcare, business, and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Hey, John, it's just about that time of year with all the back-to-school specials, and I'm getting my backpack and my lunchbox and all sorts of stuff, but something feels different this year. How about to you?
It's a scatter plot. I mean, no one knows quite what's going to happen. I mean, how can you get organized for school when we don't know whether there is going to be school?
John, I mean, I really feel like righteously indignant at this moment. You think about back in March, okay, we shut down the economy, we locked up, everybody's unemployed, we saved the healthcare system kind of. And of course, the idea, a lot of this was we'll get back to normal. And certainly by September, the kids are going to be, back to school. And here we are. And, if anybody thinks they're going back to school, I mean, I think that's, that's probably wishful thinking for most people.
Let's call it for what it is. We didn't acknowledge as a country that we had a problem. That's the first sign of a crisis, is understanding whether you know that you're in a crisis. Then the leadership at the central level was terrible. We then too quickly gave signals that people should or could open. And you've got a battle over the facts with the president that doesn't exist in other industrialized societies like in Europe or in the Far East, Japan or Korea or France or Germany. And what that means is that those countries, which have very similar demographic to ours, very similar populations, population density, rural, urban, suburban, that they actually are in a position to open. Because gosh, think about it, David, maybe not for you because your kids are a little bit older, but for a lot of folks, all of that time at home with young kids is not just difficult and potentially a real psychological burden, as well as a work burden for the parents, but also isn't great for the kids. There's a lot of benefits of school that we're missing, and you can't demographically delay kids' access to learning and socialization without demographically denying them the opportunity to grow with their cohort. So I think we've got a bunch of bad options, and I'm not even sure which ones we're going to go with. How do you look at it? You still have some kids in school.
I have a few, John. With all this kind of crazy talk that you hear out there about the pandemic, there's a couple people that I listen to. One of them is Tony Fauci, which is a lot of others, but another one's actually Bill Gates, who, even though I'm not a big Microsoft fan, he knows a heck of a lot about pandemics, infectious disease, global health. And I saw a story, and I went back to look at it from April, where he says, this is a big deal here, but yeah, schools are going to reopen in the fall, even if it's going to take the economy longer to catch up. And what that shows us is that we have really flunked the test, and it shows it in a way that also reveals some of our priorities. I mean, these shutdowns should be focused on being able to make sure that we can get kids back to school. We really haven't done it in any kind of a way. If you look at other countries have reopened their schools. There's some lessons to be learned there. One lesson is they all did it with a much lower level of community spread, and they had testing and contact tracing in place, and we are nowhere near that.
Well, but I mean, don't blame Bill Gates just because you keep getting that spinning pinwheel of death.
Yeah.
When you hit the wrong series of keystrokes. And if you're still listening to Anthony Fauci, please tell me where you're listening to him, because as far as I can tell, his voice has been pretty well choked out by the White House. But I think that you can't blame people for predicting that smart people, Zeke Emanuel, be another person who's a strong voice on these issues, who was predicting that we would open the schools and it would be a good idea. That smart people too quickly assumed that the central government would follow the lead of basic science and the successful examples of other industrialized countries. I mean, Japan has 136 million people, very dense population, so high potential for community spread. I think still less than 1,000 deaths, and they're basically open, but we're wildly exposed. Different countries in Europe that are a little bit more heterogeneous. Now, I think we just haven't done the basics, and I think your point about, community spread simply means that you start to see a bloom of new COVID vectors of infection when a group of people in a particular community start to get infected all at once, which means that we are not actually following the basics of personal hygiene and hand washing, masks, social distancing. And I know it gets a little burdensome for people, but if we just do the basics, we can cut that community spread down, by about 60 to 80%, which breaks the back of this virus. Without that, and without then being disciplined about how we then reopen, I don't see how you open these schools, David. I don't see how
Well,
you
John,
expose kids who could be carriers to homes where there's a pregnant mom. I don't see how you expose, there's I think a 20 to 30% of all teachers public teachers fall in the demographic of the most vulnerable targets of this virus. I don't see what's going to happen.
So, John, let's talk about what schools are trying to do. So, as you mentioned, we're just in a bad spot. There's no good answers. So, the schools that are trying to reopen, they're doing a few things. One is to have a kind of a system where they've got like some students go 2 days one week and 3 days the next week, and have these different cohorts, and the teachers are there, the whole time. They try to space them out a little bit more. It may work, but I'll tell you, if you have the kids who are home half the time, they're not going to be learning. They're not necessarily going to be zooming in and learning anything. So best case, you're going to go half speed. I know in my district in Massachusetts, everywhere in Massachusetts, the schools have to come up with 3 plans: an in-person plan, a virtual plan, and a hybrid plan. And they've just given them an extra 10 days to open school so they can continue with their planning. Well, that's great because they need more time to plan, but it also means for sure you're losing 10 days. And John, what we're seeing here is also a real exacerbation of disparities. So private schools in general did a very good job last spring. They were able to do things operating with fewer constraints, and they also have to demonstrate, why those hard-earned tuition dollars should be paid. And this year, same thing. They're going to reopen. They're going to be successful, and the public school students are going to suffer.
It's unfair. Now, David, the pandemic though is not managing it, not doing the basics, has created much greater differentiation between low wage workers, essential workers who are disproportionately people of color who are already suffering, who are essential and thus more exposed. This pandemic has exacerbated, made worse all of the income and racial disparities and access disparities that already existed. But I don't think you've got a lot of options than to find a better way to open the schools, even if there's modest learning. What we have to make sure, though, is that the people who are coming up with those protocols, those plans for how to open and manage schools, that they are taking the best advantage of science, because there probably are there definitely are smarter and less intelligent paths to open that either protect folks' health or don't. I mean, I think the goofiest thing I heard the other day was a parent trying to train his first grade son on how to keep a mask on for 6 or 8 hours a day. I don't think that's practical for certain kids in certain demographics, but that is sort of what his school is going to require. So as long as we're sensible and practical, there's probably a path forward. But there's no question in the public schools, it'll be a step down from what we'd ideally like to do. But I think we are in uncharted territory. I just hope that we can access the best science so that we can come up with the best plans.
So, John, I was speaking with a member of a local school committee the other day, and she was saying that the crisis that we're in as a country, and specifically public education, is the most serious thing that we've gone through since the Civil War, which is really saying something, and I don't think it's an overstatement. As long as we're looking back that far, it's worth hoping to see what can we actually do with education. During the Spanish flu 100 years ago, most public schools closed, but actually in some of the big cities like in New York and Chicago and New Haven, in your favorite state, which was a big city for a while, they didn't close. And they actually had fairly low infection rates because they were really focused on the progressive era school hygiene movement. And they really focused on health within school. And I think we're going to have to hope that that occurs.
They were willing to make serious accommodations. I mean, we had people in the midst of a very cold winter in places like Philadelphia, New York, and Boston doing all of their education outdoors. I mean, so they took advantage of what we know and they knew. They took advantage of at the time what was thought of as a progressive hygiene movement. It's called the hygiene movement, by the way, now, David. It's no longer progressive. It's called basic washing, but they were crude solutions. But to your point, they kind of worked. And I think I think the Civil War analogy is not crazy. We are at war, and we need to take it that seriously and functionally start to adjust to this notion that we live in a COVID world. We can't choose to escape it. And so in that context, let's make sure we are protecting and leveraging every tool we have. And if they could successfully teach people outdoors, in 1918, I don't see why we can't do it with bulky sweaters and down coats where it's cold in year.
Yeah, no, I agree with you, John. And especially we have the, I guess, the silver lining of global warming, that it's a few degrees warmer now in the winter than it used to be. There is also some use of technology within schools. And so, at first when COVID was being discovered and they'd shut down schools for a day or two, they do this deep cleaning, whereas probably the issue is more about airflow. So being able to have the windows open, being able to set the HVAC system so they're bringing in outside air as opposed to recirculating air, and even using things like air filters in the classroom, and maybe even some other things like UV light might work.
Go outside, David. Think about it. Go outside. It's like those great poems, those great challenges. Embrace the outdoors.
Well, it's good, John. Last time I did that, I got Lyme disease, though. So there's trouble wherever you look. Well, John, let's end on a hopeful note. Give me something positive to look forward to here for the school year.
The only positive thing I can think about with regard to the opening of the schools is that a more educated populace will hopefully make better choices, and we will be able to undermine and stop that community spread. Maybe it has to start with the kids, and then they'll drag the adults with them. That's my hopeful thought, David.
Okay, no, that sounds good. Well, I am hoping for something similar, that a little bit of a public-minded spirit may allow us to rebuild public education system and have us come out of this in a better place overall. But if that's the best we can do, John, that tells me it's about time to wrap up this edition of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening.
Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.